Good morning, everyone. Here we go again, and welcome back to my presentation. Now, before I going to explain about our specific topic today, I have some question to you. So let's listen carefully. So at the previous meeting, I have already told you that the topic I have brought up include type of health. Include disease. And does anyone know and still remember about the topics that had been discussed in previous meeting? Hello, can anybody tell me? Of course not. So cannot anybody tell about the topic for the previous meeting? I will tell a little bit about the clue. So this is a disease which is usually affects women and usually in age 15 until 35 years old. And disease had been upward in social media like TikTok, Instagram, etc. So let's conclude that topic of the previous meeting is it about yes, correct. It's about FAM or fibroadenoma mammae. So now I will explain clearly about FAM, which consists of 7 parts of the slide. And then, okay, now let's move to the first part, which is talk about what is FAM. FAM or fibroadenoma mammae is a type of benign tumor in the breast. Fibroadenoma is a type of benign breast tumor that is most often experienced by women aged 15 until 35 years old. These tumors are small in size with dense texture and are easy to move. And then these tumors are small, so may go away on their own, but in some cases, they can become enlarged and have to be removed by surgically. For the next point, for the second slide, I will tell you about what the types of FAM. Okay, in this slide, fibroadenoma are divided into several types, namely, for the first type, it is simple fibroadenoma. Simple fibroadenoma is the most common type of fibroadenoma, and this type often occurs in young women. This breed has no risk of turning malignant. And second is complex fibroadenoma. Complex fibroadenoma usually affects women aged 10 until 18 years old and must be removed so as not to put pressure on the surrounding breast tissues. And then for the juvenile fibroadenoma, this is fibroadenoma can enlarge but usually shrink over time. And for the next is giant fibroadenoma. This is the type of fibroadenoma can enlarge to a size of 5 centimeters, so it must be removed so as not put pressure on the surrounding. And the last is pilloid tumor. Pilloid tumors are usually benign but can also turn malignant. The doctor will suggest this tumor to be removed. Next is for the next point, I will tell you about what causes of FAM. This is attention to us and to women to remember about the disease. Okay, what causes of FAM? It is not yet known the exact cause of fibroid adenoma, but this condition may is usually to be related to the activity of hormone estrogen. This suspicion arises because fibroid adenomas often appear when women are of reproductive age. Fibroid adenomas often occur in women who have the following factors. For the first factors, it is fast food. Most of young women or young people who have eating the fast food because they told that the tasty is good. And for the next factor is 15 until 30 years old. This age is currently can make the disease of FAM, and then for the age is reproductive age. And third factors is take birth control pills before the age of 20. And then for next point is pregnant, and the last point is undergo hormone replacement therapy. Okay, for the next slide, I will tell you about how the indication of FAM. So remember how the indication of FAM. Fibroadenoma indication. Fibroadenomas are sometimes not recognized by the sufferer. In some cases, sufferers only become aware of fibroadenoma in their breast when doing breast self-examination or BSE, or when undergoing a mammogram or ultrasound examination. The lump has the following characteristic. For the first one is it does not hurt. And second is feel juicy and dense. Third is around the shape with the edge of the lump that is easily felt or the border feels firm. And the last is easy to move. So, although generally not painful, fibroadenoma lumps can be painful before entering the menstrual period. The lump can also get bigger when the patient is pregnant or breastfeeding and stirring after entering menopause. And 5 slide, I will tell about when go to the doctor. Okay, fibroadenoma is a breast lump that most often occurs in women. However, it is advisable to see a doctor if you experience a lump that is accompanied by the following symptoms or signs. It's like the lump feels different from surrounding tissue, and the lump grows rapidly, and the size, shape, and appearance of the breast appear to have changed. For pain of the breast does not go away even though the menstrual period has passed. And red, wrinkle, or itch breast. Next is abnormal discharge from the nipple, and the last inward nipple. So you can remember when go to the doctor and why you choose go to the doctor. This is the reason when go to the doctor. Okay, for the last slide, I will tell you about how to prevention the FAM. So this is listen carefully. It's conclude of the slide for first slide until 6 slides for today. So you can listen about how to prevention the FAM. As not above, it is not yet known what causes fibroadenoma. Therefore, how to prevent it is also not known. However, the method is as follows, and you can follow the method. It is 6 methods of you can follow to know about fibroadenoma. First is stand straight in front of mirror and observe for changes in the shape or skin surface of the breast, as well as swelling or change in the nipples. Second, raise your arm up, bending your elbows and placing your hands behind your head. Then push your elbows back and forth while observing the shape and size of your breast. Third, put your hand on yourself and lean your shoulders forward while pushing your elbows forward. Then tighten your chest muscle and look at your breast. 4 is raise the right arm up and bend the elbow until the left hand touches the top of the back. Then feel and press the whole part on the right breast to the armpit area using the fingertips of the left hand. Make contact in circular, vertical, or horizontal. 5 is gently pinch both nipple and watch for any discharge. And the last is place a pillow under your right shoulders in a lying position. Touch the right breast as in step number 4 while continue to observe the breast. Repeat the same step for the left breast. And then this is about the topic for today. Okay, so that's the explanation and material of the explanation of farm disease. For the problem of conclusion, so sorry, I cannot tell now, and hopefully at the next meeting I can conclude the topics that had been discussed. Thank you for the audience who have listened to my presentation. See you next meeting and have a good day. Thank you.